Imagine an industry that spends 3.2 billion euros a year just to stand in a room and talk.
Yeah, it's a massive number.
Right. I mean, you construct a physical space, you fly your entire corporate team across the continent, you shake hands under bright fluorescent lights, and then 3 days later, you just pack it all up.
Just tear it down.
Exactly. But here is the kicker, and this is what we're really digging into today. 60% of the first-timers walking through the door completely fail at their goal.
Which is just wild when you think about the money involved.
Right. They spend a small fortune, and they walk away with basically nothing to show for it. So to figure out why, we are opening up a 2026-2027 exhibitor planning guide.
Yeah, published by Adam Expo Stand.
Exactly. And they have built, what, over 500 booths across Europe?
500, yeah.
Yeah.
They really know this space inside and out.
So today, they are our guide into this hidden, highly secretive ecosystem of European pharmaceutical trade shows. And it really is a hidden world, isn't it?
It's a staggering ecosystem, honestly. We are looking at a world that operates entirely out of the public eye, but it dictates the flow of billions of dollars in medical innovation, drug manufacturing, global healthcare infrastructure.
Which is why you, listening to this right now, need to hear this, even if you have absolutely nothing to do with the pharmaceutical industry.
Oh, absolutely. The lessons apply everywhere.
Because what we are really looking at here is just a complete masterclass in high-level B2B marketing. We're talking about the hidden psychology of physical space and how to navigate mind-bendingly strict regulatory environments.
All while trying to close million-dollar deals.
Exactly. Okay, let's unpack this. Because to grasp why so many companies fail, we need to look at the scale of these events.
Yeah, we first have to understand the sheer staggering scale of the landscape we're dealing with. These are not, your average weekend conventions.
Right, like a Comic-Con or something.
No, not at all.
Yeah.
The personalities of these events dictate entirely different strategies.
So let's look at the heavy hitters. You have Medica taking place in Düsseldorf.
The absolute giant of the circuit.
Right. We were talking over 80,000 visitors, navigating 17 immense exhibition halls.
Yeah, 17 halls. It's heavily focused on medical technology and diagnostics.
I mean, trying to navigate 17 halls is practically an athletic event.
It really is. It is a sprawling temporary metropolis.
Yeah.
And then you have CPhI Worldwide.
Which rotates, right.
Yeah, it rotates between major hubs like Milan and Frankfurt. That one pulls in over 45,000 visitors, but its focus is highly specific.
Okay, how so?
Well, it operates as the ultimate B2B transaction hub for pharmaceutical ingredients.
Ah, okay. And the source points out a crucial distinction here that really caught my attention. The difference between a trade show and a congress.
Right.
Because on the surface, they sound like the exact same thing, just people gathering in a convention center.
Structurally and psychologically, they are completely different beasts.
Okay, break that down for us.
So a trade show like CPhI or Pharma in Paris is heavily driven by procurement and supply chains.
So it's buyers and sellers.
Exactly. You have formulation scientists and supply chain directors looking for manufacturing partners, machinery, and APIs.
APIs.
Active pharmaceutical ingredients, which are the actual raw chemical compounds before they become finished pills.
Okay, got it.
Because it is supply chain focused, the messaging on the floor can be slightly broader and, more brand-oriented.
Right. I imagine a trade show for raw materials is purely transactional. You are looking for a supplier who can deliver tons of a chemical at the right price.
Exactly.
But what happens when you shift to something like oncology? Because you can't just set up a cash register for cancer treatments.
Precisely. And that is where a Congress comes in. Take ESMO, the European Society for Medical Oncology.
Okay.
This is Europe's largest oncology gathering, around 25,000 attendees.
Wow, okay.
But the primary audience there isn't procurement. It is clinicians, doctors, and highly regulated medical affairs teams.
Oh, so the tone completely shifts.
Completely. You are not selling a manufacturing pipeline. You are presenting peer-reviewed, highly regulated clinical data to the scientific community. The entire tone shifts from commerce to academia.
That makes a lot of sense. And then throwing a wrench into the whole formula, you have events like BioEurope.
Oh, yeah. BioEurope.
Source notes it has about 5,000 visitors, and it has a completely unique model. They call it Partnership First.
This is a fascinating outlier. At BioEurope, if you show up with a sprawling, flashy, open-plan booth, you are going to fail immediately.
Really? Why?
Because the entire goal of that specific event is confidential licensing discussions and biotech partnerships.
Oh, I see.
You have companies trading intellectual property and licensing molecules that haven't even been patented yet.
So the architecture of success completely flips. You need enclosed private meeting rooms
Exact.
because the secrecy isn't just a stylistic choice. It's a legal requirement to prevent insider trading and IP theft.
Yep.
The exhibit floor is really just a support structure for a high-stakes speed dating event.
That is the perfect way to describe it.
Wait, I have to stop here. Because if these events are so enormous, right, and you have tens of thousands of eager buyers trapped in a building, how is it mathematically possible to fail? I mean, you'd think sheer statistical probability would land you a few deals just by standing in the aisle with a clipboard.
You would think so.
So how do 60% of first-timers walk away empty-handed?
What's fascinating here is that the sheer volume of attendees is actually the exact mechanism of their failure.
Wait, really? The volume itself?
Yeah. When you have 80,000 people walking past, the default human reaction to that environment is intense sensory overload.
Oh, sure. I mean, imagine walking into a cavernous hall with thousands of blinking screens, competing sound systems, crowds of people.
Right. The brain just defaults to a tunnel vision survival mode.
Yeah, I've been there. You just put head down.
Exactly. Visitors put their heads down and march purposefully to their pre-planned destinations.
So they aren't just browsing.
No, success doesn't come from casual foot traffic. It comes from understanding behavioral psychology and deploying highly specific booth design to break through that psychological armor.
Here's where it gets really interesting. Because when you think of breaking through a crowd, you think of, like, loud colors, giant logos, maybe a celebrity endorsement or a flashy gimmick.
Right, the traditional marketing playbook.
Yeah, but the source says these top-tier pharma booths are deliberately moving in the exact opposite direction.
The exact opposite.
The dominant trend for 2026 and 2027 is what they call clinical minimalism. They're using clean, white, and light gray structures, stripping away all the decorative imagery.
And replacing it with what?
Massive data visualizations.
Yep.
It reminds me of a high-end sushi restaurant. You know, if you walk into a sushi place and the walls are plastered with neon signs and 10-page menus, you get suspicious.
Right. You wonder what they're hiding.
Exactly. But if you walk into a place with a single, clean wooden counter and just 3 items on the menu, you inherently trust the quality of the fish.
That's a great comparison.
The lack of clutter signals confidence. But, I mean, in a noisy convention hall, does a boring white wall with a data chart genuinely sell better than an aggressive marketing graphic?
In this specific ecosystem, yes. Absolutely.
Yeah, really?
You have to ask yourself, who is the buyer? The person walking into that booth isn't easily swayed by a catchy slogan or a smiling stock photo.
Right. They're not buying a car.
No, they are a procurement director for a global hospital network or a lead oncologist. They are hunting for efficacy curves.
They want the hard numbers.
They want to see outcome metrics, toxicity reports, and clinical trial results. If you put up a pretty lifestyle picture of a patient running through a field...
Like in those TV commercials.
Exactly. If you do that, you actively lose credibility with them. To a scientist, data is the only language that matters.
So the minimalism signals that your science is strong enough to speak for itself without all the marketing fluff.
Exactly.
Data is the ultimate flex.
It really is.
But they aren't just taping printed spreadsheets to the wall, are they?
Oh, no. Digital interactivity is a core part of this strategy.
Right. The guide talks about touchscreen product configurators and augmented reality projecting 3D models of how a targeted therapy actually binds to a cancer cell inside the body.
It's incredibly high-tech.
And the metrics on this are wild. The guide states that using interactive elements extends a visitor's dwell time from 1.2 minutes at a static display up to 3.8 minutes.
Yeah, and in the context of a busy trade show, bumping a conversation from 1.2 minutes to nearly 4 minutes is a profound shift.
That's a massive difference.
It is the difference between a polite nod while walking past and actually stopping to schedule a follow-up meeting.
Wow.
But there is a secondary, arguably more vital reason for this interactive tech.
Let me guess. Data capture.
Spot on. When a visitor uses a touchscreen to explore a specific therapy area, they think they're just interacting with a cool display.
Right, they're just playing with an iPad.
But the exhibitor is quietly generating quantitative engagement data. They know exactly which slides that procurement director lingered on.
Oh, wow. So they know exactly what they're interested in.
Exactly. Which makes the post-show follow-up incredibly precise.
That is brilliant. But there is a physical reality to all this technology and minimalism that the source brings up, which is just pure human exhaustion, designing for fatigue.
Oh, fatigue is a huge factor.
I mean, if you are listening to this on your commute right now, imagine trying to walk 12 kilometers in dress shoes while processing high-level clinical data.
That is the reality for visitors at Medica or CPhI. They're walking between 8 and 12 kilometers a day.
That sounds
It's
miserable.
exhausting.
So your beautiful minimalist oasis has to perform just as well at hour 8 as it does at hour 1.
Right.
The source points out that if an exhibitor doesn't include comfortable seating, a refreshment point, and clear wayfinding, that exhausted director of procurement is just going to walk right past.
You have to design the physical space to intercept a very tired human being.
You are creating a sanctuary on the floor.
That's exactly what it is.
So let's say I nail the psychology. I build this minimalist, data-driven sanctuary with great coffee, comfortable chairs, and an AR touchscreen.
Sounds perfect.
I am ready to sell. But I mean, I can't just project my efficacy curves onto the wall, can I? The regulatory minefield you have to navigate just to turn the lights on seems terrifying.
It is arguably the most complex aspect of pharmaceutical exhibitions.
Really?
Oh, absolutely. You are operating under strict national promotional codes that simply do not exist in any other industry.
Right. The guide lists a whole web of them. If you are in the UK, you answer to the ABPI code. In Germany, it's the FSA Codex.
Yeah.
France has LIM. Spain has the Pharma Industria Code. And for anyone wondering why the rules differ so wildly, it comes down to how healthcare is funded, right?
Exactly. Different nations have different state-funded healthcare models, so they have vastly different tolerances for how drugs can be marketed.
And because these events move across European borders, the rules constantly change beneath your feet.
Yes. And the restrictions are intensely granular. For instance, you generally cannot use comparative advertising.
So I can't say my drug is better than drug X.
No, you cannot put up a chart showing your drug works 10% better than a named competitor's drug without jumping through significant regulatory hoops.
Wow. You also cannot distribute product samples, right?
Right, or anything containing controlled substances without highly specific event and government approval.
Even the simple act of scanning a business card is governed by strict GDPR compliance for lead capture.
Yep, the data privacy laws are no joke.
The source drops a critical expert tip here, which I found fascinating. You have to build a mandatory 4-week regulatory review window into your design phase.
Just for the medical compliance teams to argue over the adjectives printed on your wall.
Over the adjectives.
Because the wording of a single claim can violate a national code.
So let me play this out. Let's say a contractor ignores that 4-week review. They want to be bold. They print an enormous wall graphic directly comparing their drug to a competitor, and the regulatory compliance police from the event catch it on day 1 of the show during a floor walk.
Oh boy.
What actually happens? Is it just a slap on the wrist?
This raises an important question, and no, it is not a slap on the wrist. The consequences are immediate and deeply embarrassing.
Really? What do they do?
If you violate a national promotional code at a major European fair, you face on-site enforcement.
On-site.
Yes. Picture event officials walking into your brilliantly designed sanctuary and literally forcing your team to cover up your incredibly expensive graphics with black duct tape.
Oh my God. Imagine spending 100,000 euros on a bespoke architectural space just to have officials cover it in black tape while your potential clients watch.
It happens more often than you would think. Or worse, they demand an on-the-spot mandatory redesign before you are allowed to scan a single badge.
That is a nightmare.
It is.
Yeah.
But the financial loss of the graphic is entirely secondary to the reputational damage.
Oh, of course.
If you are at a clinical congress like ES, surrounded by peers, and you violate the code, you are instantly damaging your credibility.
With the very medical opinion leaders and regulatory bodies, you need to approve and prescribe your therapies.
Exactly. It is a profound institutional risk.
So if the rules for what you can say are this strict, the rules for what you actually build must be just as tight. Which brings us to the physical construction of these spaces.
Right.
According to Adam Expo Stand, corporate ESG mandates, that's environmental, social, and governance, they are completely ripping up the playbook on how booths are built.
The shift towards sustainability is no longer a fringe movement or, a nice PR angle.
It's mandatory. It
is the central organizing principle of the exhibition floor. The statistics from Medica show a rapid evolution.
Yeah, let's look at those numbers. In 2023, 24% of exhibitors used reusable stand systems.
Right.
By 2025, that jumped to 38%.
And they are achieving this through modular stands. The source describes these as reusable aluminum frameworks.
It's less like building a traditional house from scratch and more like setting up a highly engineered theatrical set, right?
Exactly. You own this underlying skeletal grid made of aluminum, and you can configure it as a small 20 square meter booth for a show in Paris.
And then you ship that exact same frame to Dusseldorf, expand it into a 60 square meter island, and just snap on different graphic skins to make it look like a completely bespoke building.
Exactly. And the guide notes this reduces per event cost by 30 to 45% for multi-show programs.
That's massive. They're hitting a full return on investment within 18 months.
It represents a profound shift in capital allocation. I mean, for decades, companies would spend tens of thousands of euros to build a beautiful, bespoke wooden structure.
Use it for 3 days?
Yep, use it for 3 days and then literally throw it into a dumpster behind the convention center.
That's insane.
That model is dead. Now, you are required to use documented recycled materials.
Like FSC certified wood?
Yes. Water-based inks, energy-efficient LED arrays.
I have to ask the obvious question here, though. Is this push for sustainable materials just corporate PR?
What do you mean?
Well, is it just so the marketing VP can take a nice photo for LinkedIn holding a reusable coffee cup, or does this actually impact the bottom line and the logistics of doing business?
Oh, it is absolutely foundational to doing business.
Really?
Yes. And here's the mechanism behind why. In the pharmaceutical sector, strong governance and ESG metrics are now hard-coded into corporate procurement requirements.
Oh, I see.
Major pharma companies have committed to science-based targets,
Yeah.
known as SBTI.
Right, they have to report their carbon emissions. For those unfamiliar with how this works, companies have different scopes of emissions, right?
Exactly.
Scope 1 is what you burn directly, like the fuel in your company cars. Scope 2 is the electricity you buy to keep the lights on at headquarters.
But Scope 3 is where this gets critical. Scope 3 covers everything else in your entire supply chain.
So what does that mean for the booth?
That means a massive global pharmaceutical company is legally on the hook for the carbon footprint of the independent contractor who screwed their booth together in Milan.
Wait, really? So the booth itself is a line item on their global carbon tax ledger?
Precisely. Event organizers are now providing mandatory carbon footprint calculators.
Oh, wow.
If your stand contractor cannot provide documented material provenance, transport emissions data, and end-of-show waste diversion records,
The big pharma companies won't work with them.
large pharma companies literally cannot sign a contract with you. You will be disqualified in the initial procurement phase before you even submit a design.
It's not a nice to have, it's a legal barrier to entry.
Exactly.
Which explains why the guide heavily emphasizes hiring contractors who actually have venue authorization for places like Medica Düsseldorf or Fier Milano.
Yes. If you hire some random builder who isn't authorized by the venue, they have to subcontract the work to someone else.
And then you lose quality control. Suddenly, nobody knows where the wood came from, the chain of custody is broken, and your compliance team is facing a reporting nightmare.
The chain of custody for materials has to be bulletproof. You need a direct line of sight from the factory floor to the convention center floor.
Okay, so we have the physical space, the psychology of the tired buyer, the strict national regulators, the theatrical aluminum sets, and the carbon calculators.
It's a lot to juggle.
It really is. How do you actually pull all of this together into a reality? Let's look at the master plan. The timeline the source lays out is intense.
They're very intense.
You cannot wake up 3 months before a show and decide to go. You have to start 9 to 12 months before the doors even open.
There's a very specific, unforgiving sequence to that timeline. And the single most important rule from Adam Expo Stand's design team, their absolute #1 piece of advice, is to book your floor space before you brief your contractor.
Which sounds obvious, right? You don't buy all the furniture before you buy the house.
Right. But apparently, companies mess this up constantly.
They really do.
They do. Exhibitors will go to an architectural design firm and say, build us something amazing, without knowing if they have a corner plot, an island, or what their aisle exposure is.
You cannot design a psychological space without knowing the physical architecture of the venue.
Exactly. And those premium island spaces, they sell out 8 to 10 months in advance.
Let's talk budget, because the numbers in the guide put the stakes into perspective. A basic shell scheme conversion, just dressing up the standard walls the venue gives you,
Right.
that's going to run between 8,000 and 15,000 euros.
Which is just the entry level.
Exactly. Because if you want one of those custom island stands with digital AR integration, structural rigging, private meeting suites, You are looking at 60,000 to 150,000 euros or more.
Which brings us full circle to the very beginning of our discussion.
The 60% failure rate.
Exactly. When you are spending upwards of 150,000 euros plus flights and hotels for a team of 20, you cannot afford to be part of that 60%.
You really can't.
And the secret to conversion, according to the data, happens weeks before the show even starts.
It's scheduled meetings.
Pre-scheduled meetings have a 4 times higher conversion rate than walk-up conversations.
4 times higher.
Yes. Think about the fatigue we mentioned earlier. That procurement director walking 12 kilometers is not casually browsing the aisles looking for inspiration.
Right, they just want to sit down.
They are moving from one targeted meeting to the next. If your team is not on their calendar before they land in Düsseldorf, you basically do not exist to them.
And once you have the meeting, the clock starts ticking. The source points out that CRM entry and personalized follow-ups must be executed within 48 hours of the show closing.
Speed is everything.
Speed is the single biggest predictor of conversion. Plus, a detail I loved, you have to train the stand team completely separately from the overall marketing brief.
Yes, that is crucial.
You can't just throw a regional sales rep onto the floor and say, go get them.
No, they need to know the regulatory boundaries, the GDPR lead capture rules, the specific product script.
They need to know what they cannot say just as much as what they should say.
It requires immense discipline.
So what does this all mean? When you zoom out and look at this whole ecosystem, it's like planning a sprawling luxury wedding.
That's a good way to put it.
But instead of family, your guests are incredibly tired scientists.
Yeah.
Your budget is 150,000 euros. You have to track the carbon emissions of the floral arrangements.
Yeah.
And you have national medical regulators watching your every move, just waiting for you to slip up.
If we connect this to the bigger picture, the most profound realization is that a trade show is not a 3-day event.
No, it's really not.
It is a highly choreographed, year-long commercial campaign that merely culminates in a physical space for 72 hours.
The architecture, the regulatory compliance, the sustainability metrics, the digital interactivity, the behavioral psychology of the visitor,
It all ties together.
these are all interconnected gears in a machine designed for one singular purpose, building absolute trust in an industry where trust literally saves lives.
Well said.
Building trust through friction. It is a fascinating world. Thank you for taking this journey with us. And a huge thank you to you listening for exploring the intricate, insanely high-stakes ecosystem of European pharma trade shows. But before we wrap up today's deep dive, I want to leave you with a final thought to ponder.
The floor is yours.
We spent a lot of time talking about the massive push toward digital interactivity, augmented reality displaying molecular structures, and the absolute legally binding necessity of reducing Scope 3 carbon footprints.
Right.
If we are already using AR to effectively show drug efficacy, and if corporate ESG mandates keep making it harder and more expensive to build physical structures and fly teams across borders,
Just see where you're going with this.
how long will it be before these temporary cities vanish entirely? Will the trade show of the future be a hyper-realistic, fully regulated VR congress where attendees can examine a 3D molecule from their office and nobody has to walk 12 kilometers in dress shoes?
The underlying technology is certainly advancing in that direction. The question is whether virtual handshakes can replace physical trust.
Something to mull over the next time you find yourself standing in a crowded, noisy convention center looking for a cup of coffee. Until next time, keep questioning the systems that run our world and keep digging deep.